All right, welcome back to the Nomiki Show. Indigo Oliver is a journalist who's written for pieces for The Guardian, The Nation, Jacobin, Conversationalist, and right now has a piece out in these times titled "A Landmark Bill Would Outlaw Cutting Off Healthcare to Striking Workers." My goodness, just another reminder that our labor laws are extraordinarily weak in this country, and there's very little oversight. Indigo, thank you for joining us and for writing this piece.
Thank you for having me.
So, I guess we should just start off with how are they? What are they allowed to do when workers strike? And are these legal strikes or are these like the illegal strikes that occur with like teachers unions and public sector workers?
Well, what I was talking about mostly was legal strikes. But when you do go on strike, what happens is your pay gets cut off. Um,
Mhm.
that's pretty standard practice. And in certain cases, employers have the option to cut your health care off as well. And it's been used as
Wow.
a threat and was recently used as a threat at the recent John Deere strike. Um, it is completely legal for them to do so. In certain cases, uh, unions like the UAW, which are much
Mhm.
larger, have strike funds, so they will support their workers through like small weekly payments, and then will also, in some cases, cover their healthcare through COBRA benefits. But I think this is really a game changer, just because it takes away one of these key strike breaking tactics that we've seen companies use in recent years, or in decades, really, but especially over the last couple of years.
So the National Labor Relations Board, the NLRB, is falls under the Biden administration, and of course was weakened under Trump. And I know a lot of the Biden administration hasn't really fully empowered the NLRB in many ways, even in the last year. But the PRO Act, for instance, is this bill that is sort of like MIA right now, I guess. I don't know if you have the latest on the PRO Act, but it could obviously strengthen the NLRB and labor laws for striking. Is this a bill that could be passed um, in case the PRO Act doesn't get passed or it gets broken up into pieces, or it just takes several years while conditions are obviously very not great right now in the country?
So I think this is something that we should look at as additional legislation to strengthen worker organizing alongside the PRO Act. Um, the question of how likely it is to pass, along with the PRO Act, is kind of like a separate story, and I don't think Democrats have really done enough to push for the legislation that they want to see and kind of like strategically negotiate with people like Joe Manchin and Sinema. But yeah, I think this is definitely one piece in a puzzle to strengthen labor overall. The one thing that I would say though is that we shouldn't rely on the NLRB too much to strengthen labor as a whole. I think the only way that we're really going to see that in a big way is if masses of organizers organize at the grassroots level and kind of demand the things that they're owed, like healthcare and the right to collectively bargain.
I've heard from Starbucks workers who I was in Buffalo this past weekend, as I mentioned in the previous segment, and learned that they would hit a lot of roadblocks and have a lot of issues in terms of strengthening their organizing, and they've been very successful, partly due to the kind of conditions you know the size of a store and how these union efforts have spread so fast. It's not striking, but it's organizing. But they have said, like, if the PRO Act was passed, this would be much easier. I'm curious, like, have you interviewed any of the congressional members who co-sponsored this bill, or do you know sort of what their mentality is behind why this bill now, and are they preparing for a fight with the PRO Act?
Yeah, so there's an interesting story behind the bill. The key person who introduced the legislation, Sydney Axnay, Representative Sydney Axnay, a Democrat in the House, actually oversees the district where a number of the John Deere striking workers were living in. So her constituents were going through this. Again, John Deere threatened to cut their health care off. And when she heard from her constituents, she was inspired to introduce this legislation. And she started having conversations with some of her colleagues on the Hill and heard that they had also had constituents facing similar issues in recent years. Another one of the co sponsors, oversaw the district where the Kellogg's striking workers, one of the part of the Kellogg's workers were striking. About 1,400 Kellogg's workers lost their health care during the course of that strike, so that was a big issue. Yeah, and I so in terms of a strike, in terms of a fight, I'm not entirely sure. I was able to get some answers from Representative Axnay through email,
Mhm.
and when I asked her about how likely she thinks the bill is to pass, her answer was sort of, well, with any legislation, introduction is the first step. So I think Democrats are pretty aware that this is going to be an uphill battle, as it
Mhm.
has been, especially with holdouts like Manchin and Sinema.
What I don't understand is how is this even legal? I mean, there is a isn't there a mandate for employers to provide healthcare if an employee is working? I mean, it's not you don't know how long the strike is gonna be. It could be, a week, 2 weeks, a month, but I assume, especially the Kellogg's workers and the John Deere workers, these are employees. They're not I assume they're not at will employees. They're on salary. So how do they get away with this?
I mean, we have a system of labor laws, I mean, really business laws in this country
Yeah.
that favor the employer. Um, so again, like I said, when you're on strike, you don't get paid, and I think that kind of in the employer's mind,
Is a loophole.
pay is yeah, exactly, is linked to healthcare. So it's like if you're not working, you're not going to get the pay or the benefits that we're giving you. Again, not every employer cuts healthcare during a strike. It is
Yeah.
specifically used as a strike breaking tactic when they know it's going to be a struggle with workers and want them to get them to the negotiating table and to just accept a contract and move on. But I think really it points to a larger issue in this country, which is employer-based healthcare. You know, if
Yep.
we did not have an employer-based healthcare system in this country, overnight workers would already be in a better position to negotiate over things that have nothing to do with healthcare just because they wouldn't have that threat looming over them. I also
Mhm.
wanted to mention that during Striketober, again, John Deere and Kellogg's workers were among some of the bigger striking groups. But during that time, healthcare was actually a huge issue that was being negotiated over at the contract table. Um, Again, like John Deere, for instance, one of their big issues that they were negotiating over was higher premiums. They wanted to
Mhm.
raise workers' cost of their premiums to 20%, which was a huge hike. A lot
Jesus.
of workers have been complaining about just poor coverage overall. And
Mhm.
UAW retirees in more recent years have also lost retiree health and benefits. So once you retire,
Wow.
you're no longer you no longer have health insurance.
Well, I mean, what's also crazy about this is you would think it's in the employer's interest to fight for something like Medicare for all because it makes your workers less likely to be dissatisfied with the company. If the limited wages, which are already cutting, are not going to just like survival. so, never made sense to me at all. I never understood why big business didn't say Medicare for all is great for business. It's great for everybody. Um, it's
I mean,
it's it's perplexing me. Mhm.
I think it's a bit of a catch-22 because again, healthcare is a huge cost to employers, especially for large corporations. It's a
Right.
huge cost. On the other hand, if they wanted to have a Medicare for all system, they know that they would have to pay more in taxes.
Taxes.
And it also kind of just goes back to this ideological issue where even if we are spending more than twice the normal OECD country in healthcare costs because we have private health insurance,
Mhm.
it's too close to socialism for people to really get behind.
Interesting. Uh, so in terms of, next steps for this bill, where does it go?
So it was recently introduced in the House. That was February 2nd.
Mhm.
Representative Axnay is confident that it should be introduced in the Senate pretty soon. I'm not really sure where it's going to go. Honestly, not many people have covered it. I haven't heard a lot about it outside of like press releases and
Mhm.
statements from unions. There have been a number of unions that have endorsed the bill. So the UAW, the AFL-CIO, the
Mhm.
United Mine Workers, and a number of others have come behind this legislation. So I think we're probably going to see some cooperation between labor and representatives, and hopefully, rank and file members will be trying to support this in grassroots ways as well.
My God. It's good to see the organizing. It's good to see some members, but obviously Washington's at a standstill right now. Really interesting conversation. Go check out this article, and in these times right now, it appeared on February 4th. Indigo Oliver authored a landmark bill would outlaw bosses cutting off healthcare to striking workers. Hopefully, many bills like this, in conjunction with the PRO Act, which hopefully will get a little bit more attention soon. Indigo Oliver, thank you for joining us.
Thank you for having me.